Hello friends, today we will be seeing Histology of Lymphoid Tissue Part 3. In Part 1, we saw the introduction to lymphoid tissue and lymphoid cells. Then in Part 2, we studied two of the histology lymphoid tissue slides, that is the slide of lymph node and thymus. And today in Part 3, we will be seeing the other two slides of lymphoid tissue, that is the spleen and the palatine tonsils. Let us first see spleen. Spleen is the largest lymphoid organ. It filters blood and lymph to remove the old RBCs and maintain immunity. Histologically, spleen shows capsule, white pulp and red pulp. It shows a hilum through which splenic vessels enter and leave the spleen. It does not have any efferent lymphatics. Capsule and trabeculae. Spleen is covered with a dense connective tissue capsule. Trabeculae arise from the capsule and enter the parenchyma of the spleen. Reticular cells and reticular fibers form a meshwork in the spleen. Connective tissue also shows myofibroblasts, which contract the capsule and trabeculae and help in discharging the stored blood from the spleen. In a fresh specimen of spleen, the parenchyma shows two zones, white pulp and red pulp. White pulp is darkly stained or basophilic and consists of lymphoid tissue. Trabecular branches of splenic artery give rise to the central arterioles. White pulp forms sheets of lymphoid tissue surrounding the central arterioles, and these are called as periarteriolar lymphatic sheets or PALs. They contain T lymphocytes and hence form thymus-dependent zone of the spleen. Malphizian corpuscles or splenic nodules. On exposure to antigen, the B lymphocytes proliferate in the PALs and develop germinal center. Such nodules are called Malphizian corpuscles or splenic nodules. They have eccentric arteriole because of formation of the germinal center. Red pulp. White pulp is surrounded by red pulp. Red pulp forms major part of the parenchyma. It is lightly stained and more eosinophilic. It consists of two components, cords of Billroth and sinusoids. Cords of Billroth, also known as splenic cords. These are irregular anastomosing cords made up of reticular cells, reticular fibers, lymphocytes, macrophages, plasma cells, and large number of RBCs. Splenic sinusoids. The cords of Billroth are separated by splenic sinusoids. Sinusoids have a wide lumen and are lined by elongated endothelial cells known as stave cells, and these cells lie parallel to the long axis of the sinusoids. They are filled with RBCs. Basal laminae of sinusoids are discontinuous. Adjacent endothelial cells are separated by larger intercellular space that allows the blood cells to pass through. Marginal zone. This is a zone of red pulp that immediately surrounds the white pulp. It consists of reticular network of blood sinusoids, lymphocytes, macrophages, and numerous antigen-presenting cells. Functions of the marginal zone. Antigen-presenting cells bring the circulating antigens in contact with the lymphocytes in the spleen and induce the required immune response. Let us now see the splenic circulation. The splenic artery, which enters the hilum of the spleen, divides into trabecular artery, and that then gives central arterioles which run through the pals, seen as peninsular arterioles in the red pulp, sheeted capillaries surrounded by macrophages, then into the splenic sinusoids, then into the trabecular veins, and finally leave as the splenic vein from the hilum of the spleen. There are two concepts of splenic circulation, the open circulation and the closed circulation. In open circulation, sheeted capillaries open into the red pulp and blood passes through cords of red pulp and finally enters into the splenic sinusoids. Whereas in closed circulation, the capillaries open directly into the splenic sinusoids. In human beings, only open circulation is present in the spleen. Functions of spleen. Spleen has immune system and hematopoietic functions. It activates lymphocytes by using the antigen presenting cells and induces immune response. It is a site for proliferation of T and B lymphocytes. It helps in destruction of old and damaged RBCs and platelets. In embryonic life, it acts as hematopoietic organ and it stores small quantity of blood. This we see a low power view of a slide of spleen where we can appreciate the basophilic stained lymphoid aggregations, and these are the white pulp showing the germinal center and the eccentric arteriole, and surrounded by this is the red pulp which is seen as the sinusoids and cords of Bilgor. A high power view shows us the white pulp seen as lymphoid aggregations with a germinal center and with eccentrically placed arteriole. This is surrounded by the red pulp. The salient features for spleen to be used for spotting are presence of outermost capsule with trabeculae, presence of white pulp with eccentrically placed arteriole, presence of red pulp rich in blood sinusoids. We now go on to study tonsils. Tonsils are a collection of lymphoid tissue near the junction of oral and nasal cavity with pharynx. Aggregations of tonsils forms Waldeyer's ring, which includes pharyngeal tonsil, tubal tonsil, palatine tonsil, and lingual tonsil. Palatine tonsil. It is the largest tonsil in this group and is located on the lateral wall of oropharynx. It forms a part of mucosa-associated lymphoid tissue or MALT. It shows lining epithelium, tonsillar crypts, and lymphoid follicles. Lining epithelium. The oral surface of the palatine tonsil, or the inner or the medial surface, is lined by stratified squamous non-keratinized epithelium. Tonsillar crypts. The epithelium invaginates the internal or oral or medial surface of the palatine tonsil to form tonsillar crypts. These crypts are lined by stratified squamous non-keratinized epithelium. The outer or the lateral surface of the tonsil is bounded by connective tissue capsule, which is seen only on this outer surface and hence is called as a hemicapsule and has some efferent lymphatic vessels. Lymphoid tissue. Just beneath the epithelium, palatine tonsil shows dense aggregation of lymphoid follicles with germinal center supported by meshwork of reticular fibers. Functions of palatine tonsil: production of lymphocytes, antigen presentation, and development of immune response. This here is a low power view of the palatine tonsil. What we see here is a tonsillar crypt, which is lined by stratified squamous non-keratinized epithelium, and just beneath the lining epithelium we see lymphoid aggregations, dense aggregations of lymphoid tissue with germinal centers. A high power view showing us the tonsillar crypt lined by stratified squamous non-keratinized epithelium, and we also see the lymphoid aggregations with a germinal center. The salient features for spotting here are presence of deep tonsillar crypts, presence of stratified squamous non-keratinized epithelium lining the medial surface, and presence of lymphatic nodules with germinal center. Thus we have studied all the 4 slides of lymphoid tissue which are there for the exams. Let us now quickly see the difference between these 4 slides, that is, difference between a slide of lymph node, spleen, thymus and palatine tonsil. In regards to the outer covering, in lymph node, connective tissue capsule is seen with subcapsular sinus. In a slide of spleen, the connective tissue capsule is covered with squamous epithelium of peritoneum. Thymus shows a thin connective tissue capsule, while in palatine tonsil, the connective tissue capsule on the pharyngeal surface, lined by stratified squamous non-keratinized epithelium, invaginates to form the tonsillar crypts. In regard to the lymph vessels, lymph node shows both afferent and efferent lymph vessels, while all the other 3 have only efferent lymph vessels. Trabeculae in lymph node are seen as thin trabeculae all over. Spleen shows abundant thick trabeculae with blood vessels. In thymus, trabeculae are only in the peripheral or cortical part. In palatine tonsil, occasional thin trabeculae are seen coming from the capsule. In regard to the cortex, in lymph node, the cortex contains well-defined lymph nodules with germinal center. Spleen is not differentiated into cortex and medulla. Here we see red pulp and white pulp. In thymus, the cortex of lobules contains collections of dark staining lymphocytes and few endothelial epithelial cells. Palatine tonsil again is not differentiated into cortex and medulla. Lymphocytes aggregated as small follicles are seen along the sides of the crypts. Germinal center is seen in a few follicles. As regards the medulla, in lymph node, medulla shows lymphocytes arranged in cords around the lymph sinuses, and these cords are known as medullary cords. In thymus, the medulla of one lobule is continuous with that of the adjoining lobules. Epithelial cells are arranged concentrically to form Hassel's corpuscles. Thus, these were the differences between the 4 slides of lymphoid tissue which we have studied. For further reference, you can refer to Sontake Yogesh, Textbook of Human Histology, CBS Publishers and Distributors Private Limited, New Delhi, 2020, page numbers 106 to 121. Thank you.